Hi, I'm Dr. Sarah West. I am a palliative care physician, and I'm here to talk to you today a little bit about how palliative care can help you during your cancer treatment. Um, Palliative care is really designed to be a supportive service while you're undergoing treatment for your cancer. It's obviously really scary and frightening when you first get diagnosed with cancer, and palliative care is really there to be an extra layer of support for you and your family as you go through diagnosis and treatment. A lot of people have questions about whether hospice and palliative care are the same thing or what's the difference. Um, the easiest thing to say is that palliative care is really an approach to care. It's trying to manage symptoms that come up in any disease and serious illness. Hospice care is actually a Medicare benefit program that you have to enroll in, and it's really designed to help take care of patients at home at the very end of their life. So they're very different in the sense that palliative care can take place in the clinic setting and during curative treatments, and hospice again is really for the very end of life. Getting diagnosed with cancer is really scary. Going through treatment can be really difficult as well. And palliative care can really help with symptom management and other things that come up during treatment for cancer. Um, the main goal of palliative care is to try to help people feel better and to support them emotionally and physically as they go through this really challenging time. Our goal is to come alongside you while you're undergoing all of these different tests and treatments, and just be an extra layer of support, um, both with medications and visits, and sometimes just to listen to what's going on. Our hope is that we can make you feel better, so that you can be more successful as you go through all of these different things. What you can expect in the clinic, we really want to try to meet you and your family. One of the things that we um, pride ourselves on in palliative care is really getting to know the whole group of folks that are being affected by this diagnosis, and we really try to figure out what's important to patients and how we can best help that. So the main thing we do is really try to get to know you as a person and try to figure out what would be the most helpful for you and also what's important to you, so we make sure that we do the things that would be the most helpful. We spend a lot of time talking with your other doctors and other members of the oncology team to try to coordinate the care as well. Um, Cancer is really scary. It also can make you feel terrible. And there's lots of things that can come along with cancer and the treatment. And palliative care is really focused on trying to help some of those things. A lot of times we can do that with medication. Sometimes we have to do it with other things like physical therapy, sometimes even counseling, and just different resources that we can help connect you with as part of the oncology team. I mentioned this previously, but cancer doesn't really just happen to one person. It happens to entire families. And one of our goals in palliative care is to really try to come along and support families that are going through this difficult time as well. Um, Families experience a lot of distress because it's hard to watch their loved ones go through some of these difficult things. And so our goals are to try to help families cope with some of these things as well. And in fact, I encourage families to come to clinic appointments, so we can get to know them as well. A lot of things happen when you're first diagnosed with cancer, and um, one of our goals in palliative care too is to help sort of deploy all the resources available to try to help manage all of the things that happen, not just what's happening to you physically, but um, all kinds of, all of a sudden your life is taken over with appointments, and there's bills everywhere, and you have to think about the future in ways you haven't had to previously. So we do try to step back and think about how we can help you plan for the future a little bit. We specifically focus on advanced care planning and trying to get wishes onto paper, because it's important to do that, and also talk with your families about what's important to them. We can help connect you with resources like social workers and nurse navigators that can help with other issues as well. one of our goals as palliative care providers is not only to help you, but to also prevent things like hospitalizations and stuff, because that can be so frustrating and can ultimately delay your treatments. And research has shown that the involvement of palliative care and this extra layer of support can really be effective in doing that. Um, we certainly want to provide support for patients who don't have as much support at home as well. So again, one of our goals is just to come alongside patients in any walk of life and in any stage of their disease and try to see if we can be helpful. It has really been my privilege to be able to be alongside patients on their journeys through cancer. Um, I think I get a lot of patients who are frightened of palliative care and what it means. And I would just tell you that it really is a relationship more than anything. And I feel like a lot of these patients have become my friends as we go through this very difficult journey together. Um, and would just encourage anyone to reach out to their physicians about getting palliative care involved in their care, for the simple reason that we're just here to try to help in any way that we can and make this very scary time a little bit less scary. Thank you so much for joining, and if you need any information, you can find us online.